Honorable Deputy Speaker, sir, I express my thanks to the Honorable Member for Maukarwat, Baranington L. Tongkhar, for giving us this opportunity as a Department of Health and Family Welfare to attend to a very new but quickly evolving concern in the matter of the content and extent of his motion, which discusses comfort care treatment facilities to patients in government hospitals, sir. Sir, as correctly indicated by the mover of this motion, comfort care treatment is designed to alleviate symptoms, manage pain, and enhance the quality of life for patients facing serious illnesses, chronic conditions, or those nearing the end of life. So disease is very cruel, sir. There is no bar, no age bar. There is no social strata bar to patients who have endured this big challenge of illness. What is most painful, sir, is in this generation, newborns are also not out of the challenge of this very important attention drawn by the Honorable Member in his emotive motion, sir. Today, sir, rarely you will find any member of the community who has not felt the pain that the Honorable Member feels. And yes, sir, I empathize with him and the thousands of families who do not have this privilege of coming to a Meghalaya Legislative Assembly to discuss their problems. This is the dynamic nature of the Department of Health and Family Welfare, sir. We are very aware, sir, that palliative care is an expensive affair. But Government of India, Government of Meghalaya is now well seized of this challenge. We are approaching to better diagnostic centers, comprehensive infrastructures to attend to all of these various diseases that cripple the community to the extent of a feeling of helplessness. I too have felt it. And I too have seen in my tenure of an MLA the extent of damage that disease can cause to families and communities. So I have two options before me. One, just read this prepared speech. Or two, concentrate on the areas of concern and go out of the predictable nature of a minister reading out a speech. And I choose the latter, sir. I will try my best to enlighten this august house. Very often, the cart before the horse parody is an often taken route. Condemn. Look at the weaknesses. look at the shortfalls, the shortcomings. But sir, in this day and age, sir, the Department of Health is rising to the challenge. Sir, in response to the Honorable Mover of this motion's point about the technicalities of LAMA, leave against medical advisory. So very often, a doctor in our facility, though his heart is with the concern for a patient, needs to leave decision taken to families and family parties. We have seen, Honorable Deputy Speaker, sir, that patients had a good chance to be treated by our doctors, but preferred to leave against medical advice. Once the patient is taken out of the care of the hospital or the facility concerned, there is degeneration. There are so many factors which lead to patient parties opting for LAMA. And by the time they bring back a cancer patient to our facility in Civil Hospital or Tura Hospital, so many experimentations have been experimented by patient parties. And usually they come at the very last, most painful stage. But yes, should a government facility prepare itself for the eventuality of this deterioration of a patient? Yes. We are strengthening our facilities through the Pradhan Mantri Jan Arogya Yojana, the PMJAY scheme. And sir, we are strengthening our secondary and tertiary care hospitalization for such vulnerable populations. What are we doing in this scheme in the government of Meghalaya with its state component of share? And the consolidated effort put in by the Department of Health and Family Welfare. Sir, we are financing and investing valuable funds to upgrade our various health facilities. The Health and Wellness Center, sir, is a scheme that circles around predominantly over and above the immediate medical attention that a patient may require, even if it's not a life-threatening situation. But it hovers around care. We are looking at a care which is curative in nature, which is rehabilitative in nature, and we are definitely including the palliative care in the packages that we offer for the universal coverage of health care for every citizen of the state of Meghalaya. So the Department of Health and Family Welfare and its huge battery of doctors, specialists, medical officers are of the opinion that we must change gear in our approach to tackling the problems of healthcare in the state of Meghalaya, to attend to the changing dynamics of presentation of various diseases in the state of Meghalaya. We are investing heavily in the non-communicable disease program of the state of Meghalaya. Very often, sir, members may have experienced personally or in their service as MLAs. Suddenly, out of the blue, you hear that a patient you just met in the morning collapsed and died. So therefore, preventive care has to take presence in all of our activities in our various centers. So we have also looked at improving the kind of facilities that we have in our institution and reach one step further towards the person, service to the person who's suffering the most. So we have the JAS, which is very much in operation in the state of Meghalaya. This is the Jan Arogya Samitis. Who is constituting the JAS team? Every DC in every district has been told to initiate a JAS presence in every village. You have the community, you have a convergence of our ASHA workers, we have the Anganwadi workers, and we have the village health council authorities. So this team, sir, is a team which looks at treatment away from hospital. We have home visits, we have door-to-door checking and collection of data and survey of patients, so that we are able to, as a government, expand our MHIS scheme, so that it becomes a dynamic list which is conditioned primarily not by predictable diseases that can be attended to in the universal coverage, but particularly to ensure that whenever the need arises, the MHIS should and must coverage any disease and requirement thereof by a citizen of the state of Meghalaya. So we also have worked on the e-Sanjeevani networking, what we call digital health integration, so that a patient who is in need of medical advice and attention, even if being treated at home, can access through these teleconsultations that are there. But maybe awareness is the need of the hour. We have to publicize the presence of these institutions that are there at every village level. Today, in the e-Sanjeevani networking digital health integrated system, we have 51 specialists which have onboarded themselves. But maybe people don't know. So palliative care, like I said, has no age bar, has no community bias. It is across the board. And the state, in its ambitious intention to start the 2 medical colleges which are run by the state government, will also achieve the same end. We have been finding problems finding specialists. So what is most painful is that Alzheimer's, dementia, and other such diseases are slowly consuming our population. And sometimes the way out is to educate the masses. We have to educate the masses to move away from practices which have been practiced for long. I have a cancer, The doctor can't treat me, let me go to a natural healer. Does that work? We need to fight this. A systemic corruption within ourselves, which is detrimental in the long run to the population at large. We need these specialists, and these two medical colleges will create the gap that is there, and that is why we are determined. And I must also thank the Honorable Chief Minister for his constant support to the Department of Health and Family Welfare. Time to time, we go to the Honorable Chief Minister to discuss the dynamic manifestation of some of the diseases that are slowly becoming important. I am confident that 5 years down the line, we will have trained personnel. Today, neuro-onco surgeons are rare in the state of Meghalaya. Hence, patients have no option but to leave the comfort zone of their homes and get treatment in another location, another state, sometimes even overseas for those that can afford it. We are confident, sir, that the psychiatry department in the state organizations will strengthen. Suicidal tendencies. Once upon a time, sir, we used to read in a novel or see in a film. But today it is a practice. Today it is consuming the community and corrupting the mind of the community to a large extent. Should the government be a mute spectator? No. We will rise. And we will see how we include the education department, the teachers, the physicians, the ASHA workers, the Anganwadi workers, so that we fill the gaps and start discussing our problems. What is this non-disclosure of position of health or status of a health or an ailment of a patient? Very often, our community, we are not ready. I often ask doctors in my visit to the districts and different locations, in the several numbers of inspections that I have personally gone and attended, why don't you tell the patient the truth? Many doctors themselves need a training. What do you disclose and what can't you disclose? Modern practices are now a common trend. We have to train our personnel, which is why we invest so much on medical education and career progression of our staff. We are forcing our medical officers who are refusing to go for advanced career progression programs because they are happy in their comfort zones. We are changing. Our doctors are changing, sir. Gone are those days when doctors become consumed by their comfort zones. Our doctors are now very hardworking. I know that a doctor in a PHC is likely the only source of hope for the hopeless. We are requesting our doctors, sir, to walk the talk. But training and exposure trips, sending them to facilities where all of this is included in healthcare, is what we need to do. Sir, civil hospital in Tura, the tertiary care hospitals, are also improving in their services. And yes, we have to remember that sometimes when a patient has lost all hope in medicine, he turns his hope to God. We are a Christian state. Whether you're Christian, you're Hindu, you're a believer. All believers have their own corrective, supportive treatments for patients. And I request patient parties to reach out to the various groups that are already in operation. So we have, like Dr. Celestian Lingdo, the Honorable Member of Umsning, has requested us to have advocacy groups. We have several groups, sir, for people suffering from various ailments, be it cancer, be it HIV/AIDS, be it drugs. We have these advocacy groups, and we are also working to include them in a lot of our activities in all of our facilities. Sir, I could go on and on as to what the department is already doing. So today, Civil Hospital has what we call a respiratory care unit. Today, we have the counseling and therapy and psychological clinics in Civil, in Tura. We are going one step further, sir, and we're also having an adolescent health-friendly clinic with the rate at which young adults expose themselves to risk. We have to talk about it. We are doing it. We have the complementary therapy services like acupuncture, massaging. We've built a very strong Ayush department. We now have the naturopathy department. We are encouraging yoga, meditation, and inculcating holistic wellness and stress relief in our community. Sir, even the simplest things like hygiene and self-care, communities across the state still need hand-holding on that. On the International Women's Day celebration, I was so happy to be giving sanitary pad vending machines to institutions. We have to talk about it at the rate of 10 rupees. What is cervical cancer? This morning I attended a funeral where a very senior citizen discovered at the fag end of her life that she had cervical cancer without any knowledge. The other day I went all the way to Pacharth Mangar's constituency, where again there was a senior lady who had no inclination. We are now encouraging tests. We are encouraging citizens to be concerned about knowing your own body. Most of the time, most of us do not want to go for screening. But sir, today the department has conducted so many screening tests across the state of Meghalaya. Therefore, sir, when you look at the kind of increase of footfall of patients in all of our facilities, one positive indicator, the rainbow behind that cloud, is that we are increasing our footfalls, which means people are now sensitized and educated that they must reach out for medical help and they must know their bodies. And we will try our best to continue in this direction, and we will try our best to include all kinds of diseases in this huge obligation that we have to the population of the state of Meghalaya. I thank the honorable members, both of them, for participating. Important for us to share some of the efforts that we have made in the department. So there was a mention of private room facilities. Sir, we are trying our best to also improve our infrastructures in our various centers. We are working hard to ensure that performing institutes are given this additional help, assistance, to increase the number of private rooms in their various facilities. Sir, Government of Meghalaya is equally concerned on this seemingly extremely difficult avalanche that is hitting the department to change its practices and its ways. And we are studying ourselves. We are evaluating ourselves through various ways. The various awards initiated by the Honorable Prime Minister. Our facilities now are getting all of those awards. It is self-evaluation, introspection. What is it that we need to do? And let me assure this Honorable House, sir, that we will be on the job. We will work hard. We are working on ensuring that we improve and expand the HR in our various institutions. We are grateful that the Honorable Chief Minister has given us more nurses, more doctors. Earlier on, when the state was first formed, the Department of Health was this small, but today we have expanded. We are grateful to the NHM, the Honorable Prime Minister, for the various interventions that have occurred to enable the Department of Health and Family Welfare to expand itself, to rise to the occasion, and to face these challenges which are very dynamic in nature. I hope, sir, without giving too much information on data to the two members who have risen on this house to participate, I hope that I have been able to satisfy your learning. I hope that I have embalmed the pain that you feel. I hope you have confidence in your own government. And I want to assure every member, sir, and the public in general, we will try our best, we will rise, and we will concentrate on early detection. We will concentrate on improving our diagnostic centers. We will concentrate on increasing our screenings. We will send our doctors for proper trainings. And I hope, sir, that by 2032, on achievement of the $10 billion dream that we are piping, our facilities will also benefit, and our efforts will continue to protect whom? The interests of the people of the state of Meghalaya. With these few submissions, sir, I resume my seat, sir.
Thank you.
Yes,
Tongpat.
I have one clarification, sir. And first of all, I must thank the Honorable Minister in charge
Health and Family Welfare for replying this motion. Of course, sir, I am happy to hear from her. There are so many things that the government has initiated to help the patient, but we know that it's still not sufficient, sir, especially MHIS. We know the fact that under MHIS, patient still have to pay, and only certain amount that can be recovered from MHIS. Sir, I just want to put a very specific question to the Honorable Minister. And I just want to remind this House that there are many things that Meghalaya do, and then the rest of India follow. So I want to put a specific question: if the government of Meghalaya examine to create a comfort care hospital, at least one hospital in Meghalaya, comfort care hospital, because you see, sir, all these days we are talking about how to cure, but now it's beyond the curing. That those patients whom we know that we are not able to cure, so we need only to keep comfort. So will the government examine to create a comfort care hospital in the state of Meghalaya? This is only my question, sir.
So the government of Meghalaya, through the Department of Health and Family Welfare, is well versed with a comprehensive geriatric care. It's a consolidated policy. Yes, it is always, we are always ambitious of expanding our facilities. I will not commit here, but I will assure the Honourable Member that in the existing centres, we are already designating a 10-bedded geriatric ward, civil hospital, Shillong and Tura, Jowai. We are on the job, sir, and we hope to be able to achieve it, sir.
Thank you.